Hello students, welcome to Biology with Vasianjum YouTube channel. Today I am going to talk about the cardiac cycle. And the cardiac cycle I will let you know about through this graph of the pressure graphs. And three pressures are taken in this. That is, first is this one, ventricular pressure, that is the bold line, and along with this the tracing line is dotted line is atrial pressure, and above it is ventricular this is aortic pressure. So three pressures: ventricular pressures, atrial pressure, and aortic pressures. These are depicted in graphs on the timeline 0 to 0.8 second, and that is one complete cardiac cycle. So let us understand first the anatomy of heart. So you can see here these two receiving ends of the heart, and that is two chambers, left atrium and right atrium. These are two are receiving ends. Blood is received at these two ends, left atrium and right atrium. And these two are pumping ventricles, left ventricle and right ventricle. So as you can see, the blood coming at this end, and blood is pumped through this end, ventricular end. So this end of left atrium is connected with left atrium is connected through pulmonary vein to the lungs. So lungs is joined with through pulmonary vein to left atrium, and these are the systemic vein or vena cava which joins the body to right atrium. But these two ventricles are joined through aorta. This left ventricle is joined through aorta to the body, and these are the pulmonary artery joining to the lungs. So these are the sides from where the oxygenated blood flows, and these are from where deoxygenated blood flows. So one thing which I want to tell you, that this human heart is actually myogenic heart. That means the contraction of heart is initiated through the specialized heart cells, heart muscles, ventricular muscle, the specialized heart muscle that is called nodal musculature. So this nodal musculature starts with this SA node. These are the island of cells, particular specialized cells, and is specialized in terms of its functions because this can generate action potential or current. That will be the initial point, or which can cause through a number of other downward the specialized nodal musculature. So it is the first nodal musculature, SA node, and this is AV node. So from SA node you can see the action potential or current generated is spread to the atrium, and also comes to this AV node next to SA node. So AV node further goes down to form bundle of his left and right bundle, and lastly Purkinje fiber, which ends into the ventricle, ultimately causing the synchronized atrial contraction or systole. So these were the these are about nodal musculature cells, SA node, AV node, and downward to the Purkinje fiber, till the Purkinje fibers. But these systoles, synchronized systoles, are in a timely fashion. These systoles, and of course diastole after that, which is the relaxation period of the heart. These two phenomena, systole and diastole, contraction and relaxation of heart, are the things which may be understood in terms of the sequential events which collectively can be called a cardiac cycle. So it starts with the action potential, and action potential is nothing but the generation of current, certain millivolt current, and that action potential causes systole, contraction, ultimately the contraction of atrium and ventricle. So atrial systole is first thing which happens here, through the spread of SNOD current, and is atrial systole. After atrial systole, when it spreads further, it causes the contraction of ventricles. So it is the ventricular systole. So after atrial systole, ventricular systole. But meanwhile, when the atrium ventricle is in systole, the atrium does not stop, because there is a delay in atrial systole and ventricular systole. So that gap or delay is utilized through the atrium into its diastole phenomena. So after atrial systole, there is a ventricular systole, and after that atrial. Meanwhile, it is atrial diastole and ventricular diastole, of course, sequentially. These two common phenomena under the some intersection of some common duration of this systole of atrium and diastole is called joint diastole, where atrium as well as ventricle are in diastole. So this is the complete cardiac cycle. Now what happens in this cardiac cycle when we talk about in terms of the pressures, different pressures. So different pressures, the first pressure is the ventricular pressure, then atrial pressure and aortic pressure, these three pressures. So first two, that means ventricular pressure and atrial pressure. These two are depicted here, ventricular pressure and atrial pressure. But now it is the third pressure or aortic pressure that is depicted here, starting with this 80 mm of Hg, and the peak of this ventricular pressure is 120 mm of Hg, while it is starting nearly to 0 mm of Hg. Now you must ask that what is this aorta? So as I have said earlier, that this ventricle is joined through aorta to the body. So now I start to make you sure about this, know about this, these changes of these three pressures, and how it causes the working or pumping of the by the heart. So you can see here that this ventricular pressure and atrial pressure at some point of time coincides or intersects. So after that the ventricular pressure shoots up, but atrial pressure is at the same level. So this shooting up of the ventricular pressure is the atrial systole. So this is the ventricular systole. So this after atrial systole, there is a ventricular systole or shooting up of the ventricles. When this ventricle is in systole, so the pressure of the ventricle is increased. Blood pressure of the ventricle is increased due to the systole, contraction of the ventricle. So this is what we can see here, this increase in the ventricular pressure. So after that it goes down when the ventricle is relaxed. So it is the down curve of pressure, and it is the relaxation period of the ventricle. And atrial pressure is not too much increased within this period, so it is at the baseline. But this aortic pressure at this point of time, when the ventricle goes up and comes to the point of 80 mm of Hg. So this point of intersection of ventricle, when ventricular pressure is increased in comparison to the aortic pressure. So this is the point where ventricular pressure increases from the aortic pressure. So this increase is the point where we can say that and after that relaxation period, relaxation of the ventricle goes down, and at a point it comes to equal to the atrial pressure again. So this increase and decrease of the ventricular pressure, and coming to at a time coming to equal to the pressure of aorta, and decrease than aorta, and equal to atrial, causes some phenomena which we can learn in terms of this phenomena. So it is atrial pressure when the ventricular and atrial pressure is same. So this atrial pressure is in systole, and it equals the pressure of the ventricle. But when ventricle starts contraction, or when the ventricle is in systole, so this is increased than the aortic pressure. So this ventricular pressure is increased than the aortic pressure. Aortic pressure is this one, so ventricular pressure is increased. So when ventricular is increased, we can easily understand that this increased pressure of ventricle will push this valve, or this valve is called mitral valve. That is the atrial left side atrioventricular valve, atrioventricular left side atrioventricular valve, that is called mitral valve. So this pushes the mitral valve to close when the ventricle is in systole. So when the ventricle is in systole or increasing, then the atrial pressure. So there is a closer. There is a closer of this mitral valve. So I have written here this closer. This point of excitation is the mitral valve closer. But this further increased to the point of aortic pressure. So when aortic pressure, when this increased pressure is more than this aortic pressure, when this end of left ventricle is joined to the aorta, so in aorta the pressure is less, but due to this ventricular contraction it is more. So when it is more than aorta, this valve or semilunar valve or aortic valve will push open, and the blood is pumped to the aorta. So this is because the pressure here is more than the pressure here. So blood is pumped. So this is the point when aortic pressure is opens. So this is the point when aortic pressure opens. Now we can come to this point when the ventricular pressure is till the point when the ventricular pressure curve is more than this slope and this slope. So this is more than any other slope of the ventricular pressure differential. So it is more and it is the rapid ejection period. But what about this period when the mitral valve is closed and aortic valve will open? When aortic valve will open means before that it is also closed. So both these mitral valve and aortic valve are closed within this period. So when there is this valve is closed, this valve is closed, so there is no scope of filling or pumping of the blood. So it is the isovolumetric or equivolumetric contraction of the ventricle. That means nothing is coming, nothing is going, blood is not coming, blood is not going to the left ventricle, and the volume of the blood is maintained constant. So this is isovolumetric or equivolumetric contractions. So this period is isovolumetric contractions. After that, rapid ejection, because the differential of the peak is more than the next points of time. For the peak differential is more, so there is a rapid ejection. That means when this ventricle is contracting more, so this pressure is more, increase in pressure is more, so that is rapid pumping. When the increase in pressure is less at the later period of contraction, so the pumping of blood is less, or ejection of the blood is less, or reduced ejection period. So this is reduced ejection period, this is rapid ejection period. After that, you can see here at this point when the ventricular pressure goes down to the aorta, then the aorta. So when then the aorta, ventricular pressure becomes less and aortic pressure becomes more. So this pushes this valve, aortic valve, to close. So this it becomes closed at this point of time when ventricular pressure is low. And ventricular pressure is low, this closes. So this is the closure of aortic valve. Now we can come here now when the ventricular pressure is decreasing down and down and down to the point when it is less than the atrial pressure. So when it is less than the atrial pressure, this valve will open. When it is more and it is less, this will push open the mitral valve. So mitral valve is pushed open at this point of time. So what about this period when the aortic valve is closed and mitral valve will open? That means it's still closed. So this period when the again both the valves are closed. So again both the valves are closed. But the difference with the IVC or isovolumetric contraction is that here it is the ventricle is in relaxation. When the ventricle is pressure is less, when the ventricular pressure is less, it is in relaxation. So it is isovolumetric relaxation. When again both the valves are closed, this valve closed, this valve closed, that means isovolumetric relaxation period. So after that, we can see here that it is the rapid ventricular filling. So it is rapid ventricular filling. It is the starting point when the pressure is less. It is empty. So ventricle is empty and blood is pushing into the ventricle. So at this point, it is the increase. At this point, it is the ventricular pressure is less. So ventricular pressure is less. The filling is more, or rapid filling period. But after that, when the ventricle is partially filled with blood, so pressure is more and pressure differential is less between atria and ventricle. So the filling of the blood becomes reduced. So it is reduced ventricular filling or diastasis period. Now after understanding this, we can come to understand two more things, that is the sound. When we feel it through the stethoscope, use of a stethoscope, we can hear four sounds rather. These two sounds are important, sound 1 or sound 2. So it is lub and dub. Sound 1 is lub, sound 2 is dub. What about this sound? Sound 1 or lub, it is the isovolumetric contraction period when the mitral valve is closed. So when this mitral valve is closed, so it produces sound called lub. So it is not in fact actually about the mitral valve only, but it is about these two atrioventricular valves. Because in our example we have taken only this mitral valve into consideration. But the fact is that when these two valves are closed, atrioventricular valves, this lub sound is hard. So it is at the time of isovolumetric contraction when this mitral valve is closed. But when this aortic valve is closed, when this aortic valve is closed and aortic valve is closed, when this aortic valve is closed, so this closure it causes this sound or dub sound. So this is dub sound starting with the aortic valve closure, and this is the lub sound starting with the mitral valve closure. So after that, two more sounds are there. That is the third and fourth sound. So this third sound, you can see that this is in the period of ventricular filling, early ventricular filling, and this fourth is in the late ventricular filling. This is rapid early ventricular filling, and this comes to this point of atrial systole vertex, late ventricular filling. So this were, and this is the timeline where it is in 0.8 seconds. 0.8 seconds of cardiac cycle period is because 72 beats take 60 seconds or 1 minute. So 1 beats will take 60 upon 70. That may be calculated to 0.8 seconds. So this is the 0.8 second cardiac cycle period. So this were all about the cardiac cycle, and we have understood it through with the help of this graph of pressure, blood pressures in mm of Hg. So if you have understood things, and for any doubt you can ask it through the message box. Thank you.